Hello, everyone. This is Dr. Rob Van Bergen from Pain Free for Life, and welcome to our next Monday 10-minute training. You can see here it's the middle of summer, and I'm wearing a sweater, which says a lot for the weather up here. I hope everyone else is enjoying the summer, being able to actually get some sun. It's so good for your body. Today, I've got somewhat of a repeat episode. I was a little bit hesitant about doing it really, but it was so heavily requested by the community that we're going to do it again. But there are some new twists on it. So we're going to talk about post-COVID treatment, post-COVID, otherwise known as like long haulers or long COVID. Uh, we're going to focus here with a focus on the ability of post-COVID to reactivate latent viruses within the body and within the cells of the body and cause all manner of issues. So we're going to address the symptoms of long haulers, but then we're going to look into the ways we can help combat it with microcurrent and beyond. So let's jump in. We got to do this in 9 minutes to keep with our 10-minute training philosophy. So, although many people fear getting COVID in the first place, post COVID actually seems that in many ways it can affect people worse. It is a very, very debilitating condition. It can impact people for weeks, months, and beyond. We really don't know 100% how long this can last for. The common symptoms of post COVID are that many of you may have experienced them or heard of these: fatigue, shortness of breath or difficulty breathing, cough, joint pain, chest pain, memory, concentration, or sleep issues, muscle pain or headache, fast or pounding heartbeats, loss of smell or taste. There's depression, there's anxiety, fever, dizziness when you stand. Um, Symptoms, all of these symptoms amplifying after physical or mental activities, even things like diarrhea and stomach pain. So that is a long shopping list of things we don't want to have. But with post-COVID, with long haulers, we can inadvertently inherit these and they can stick around. Now, the major issue here, obviously, is that by themselves, any one of these things may not be a huge deal. Some of them are obviously worse than others. But combined, two, three, four, five, 10 of these is incredibly debilitating. Not many of these are super easy to live with, and the symptoms really appear to last for weeks and weeks, and sometimes even longer. So, about 4 months ago, I did another video like this. So my recommendations in this video are going to be similar, but don't run away yet. There's a few additions that we have kind of come up with as we've learned more through experience. I mean, long haulers is something that, it's only really been a problem for the last few years, right? And it's something that as we see people struggle, in private consultations here, I might see someone struggle and I make a different suggestion and then a different suggestion. And it's the things I see when I'm working one-on-one with people that can inform my suggestions for you, the people who work on yourselves. So really, this is just experience and what I've seen work. So first off, it is still important to do these basic protocols for symptom relief. So the first thing is immune enhancement. This one isn't super time consuming when you get the hang of it, but it's going to be key at speeding up your recovery time. It really is something that you should be continuing to do while you're dealing with long haulers. Vagus nerve stimulation should be continued 4 times per day, no question. Most of the symptoms I read out are impacted by inflammation. Inflammation is going to have a dramatic effect on them, and you need to really work through those things and work through that inflammation if you want to get those symptoms down. So vagus nerve stimulation can be done up to 4 times per day, or like 1 20-minute session is good. If you're still having a hard time breathing, the respiratory protocol or the little clouds protocol are really good. The use of nitric oxide is great too, because this can enhance circulation. And we got to remember nitric oxide, especially the sublingual version that we have, this has been shown in many studies to actually dramatically improve the COVID symptoms, like to get rid of the COVID symptoms. It really helps to bring in circulation and reoxygenate the lungs, and in turn heal them. So someone in the comments there is saying, I'd love more guidance to learn vagus nerve without triggering the muscles or arteries. Now, it's not always possible to avoid triggering these areas here. But what you want to do is you want to feel for the pulse, right? Feel for the carotid artery. You normally can't I can't hear it if I'm talking. Once you feel it there, you want to just go behind it a little bit. Now, I don't put a huge amount of pressure. I put just a little bit of pressure with the Y probe. And typically, I'm going to feel a jiggle. That jiggle is almost necessary to know you're in the right spot. You don't want to put too much pressure because if you put too much pressure, you could occlude the artery, and that is not good. You could pass out from doing that. So, just a decent amount of pressure, enough that you're getting contact, and adjusting the power as you go is the real trick to vagus nerve stimulation. If you're looking in the mirror and you're kind of like, am I in the right spot? You want the ball is typically going to end up being the top ball is going to be about an inch below your earlobe if you're in the right spot. Generally, this is the way to go. There's not much you can do about the muscles, right? I mean, they're going to move. That's the jiggling in there. But just keep it tame. Keep the power down to where it's barely jiggling, and you'll be good there. So, to jump back to where I was, just a mini recap. If you really want to get this done with the lung protocol, you want to make sure you're doing that respiratory, or what we call little clouds protocol on the lungs. And using nitric oxide is great. I like to do the respiratory protocol for this with 77 hertz because there's a lot of scarring that happens with COVID lung. It tends to actually look worse than if you've been smoking your whole life. So you want to break that scar tissue up. Now, one tip is to use something like the massager probe, which unfortunately I don't have on my desk right now. And just, this doesn't have to be, we teach it to go up in the L shape, right? So from the edge of the body towards the middle and then up the spine. But really, the lung protocol can be as simple as just painting over the lungs. You don't have to do the exact pattern. I like to do it at least once because it means you avoid missing things up and you're pushing the energy in the right direction. But you really want to just get inflammation out, get active zones out. So you can actually just do this. You can see how easy it is. If I was doing this on my bare chest and I had inflammation, I might get some sticky spots, but that's key. That's crucial to get rid of those sticky spots as we go. So be creative with your protocols, people. You don't need to follow them to a T. It's really about which methods get the frequencies into the body. And on yourself, you can't reach your back very easily and do this, right? Do the front. I prefer the back for the lungs, but if you have to do the front, do the front and just go over it, making these cloud shapes. The massager electrode is so easy to do that too. So this stuff, all the stuff we just talked about, that's the stuff I talked about 4 months ago. Still good. But what's new? So new additions to the protocol attempt to address fatigue and enhance the body's anti-inflammatory capabilities. So numero uno, I hope I said that right. You see the adrenal glands here. Now, we're going to be stimulating the adrenals. Now, adrenal glands, the adrenaline that is released from our adrenal glands, this can be key to dealing with inflammation, right? This can help us deal with allergic reactions, which are inflammatory responses. So, in part, doing the other protocols like vagus nerve stimulation, this is helping to provide appropriate terrain in our body. This is making our body healthy. It's keeping us calm. It's allowing us to bring in more energy and keeping our adrenals topped off. Now, what you're going to want to do here is you're going to want to treat the adrenals directly. I like to dose each adrenal if possible, just setting the device to a dosing mode like 60 hertz or assess 60 hertz, whatever it may be, and place that on the adrenal area. There's an image I threw up on the screen. Hopefully you guys can see it. It's just a slide there. Just a picture of the adrenals I pulled off of Google. I think it's from the Mayo Clinic or something like that. But you want to kind of pay attention because you'll notice that the adrenals are like these little like gnome hats that sit on top of the kidneys. And you'll notice that one is a little bit higher than the other. Now, keeping in mind the perspective of the body there, we're talking about the left one typically being a bit higher up than the right one. Now, really, it doesn't matter. I find that a lot of people miss the adrenals and they'll go to the kidney area anyway, but it still has the desired effect as the microcurrent disperses into there. We want to trigger the brain to acknowledge the adrenals and potentially stimulate them enough to activate some adrenaline release. So, um, if you're going to be treating solo, it's pretty hard to do this because you can't really get to it through the front. You want to be going through the back. So if you're treating solo, I will be honest with you guys. I tried to do this weekend myself. I tried to treat my own adrenals solo. My son ended up helping me. It was pretty funny actually, as I was kind of stumbling around, like I was using a cane trying to reach my back. But my son kind of just went over and was like, "I can help you, Dad," and he grabbed it and just helped me with it. So having someone help you is great, but even a kid can do it apparently. But in the absence of this, you can use the Chi Wave pad. It's not as good because it doesn't make the biofeedback connection, but just put the pad behind your back, use 77 hertz or 90 hertz. These are good options to try and recharge the area a bit. So the next new thing is gamma to the brain and the cells. So treating the brain with gamma may help to reprogram it out of the COVID mode that it is stuck in. So this can be accomplished with conductive pads, particularly the third eye pad. So there's a pad that can sit right in the center of your forehead there, right here, or the Chi or the Via Chi. And really doing 5 minutes with the microcurrent method or 10 to 20 minutes with the Via Chi option, just kind of putting that pad on there right on the center of your forehead and running gamma. Now, gamma is your 32 to 45 hertz. So this is a brain detox wave mode. You don't get it unless you sleep deep. And if you have long haulers, you're probably not sleeping great. So you're missing out on this capability of the body to cleanse the brain. Now, additionally, what I've been seeing is that you can use the gamma in other areas of the body as well. So this can show some promise in managing the issues with the latent viral attacks that are rising up during long haulers. So if this is a problem for you, my recommendation is to take the Chi Wave pad, preferably the large one, and either hug it on your torso or put it behind your back and run gamma, your 32 to 45 hertz, or in the old pro sport, it's FM 32-45G. And you place this behind your back or on your front and just run it on the torso for 10 minutes at maximum power. Those are the new additions. However, all of these things aside, if we really want to get rid of the underlying root cause, there are two key protocols that we are looking at. So the first is tongue stimulation, and the second is scalar chi therapy. So tongue stimulation involves the use of this handy dandy tongue stimulator here. Don't try and do tongue stimulation with the Y probe. It is not as good. I promise you that. It's not the most comfortable option, but the tongue stimulator is perfect for this. And what you're essentially going to do here is you're going to be stimulating the tongue in order to rewire any cross wires in the brain. And this is because the nerves in the tongue actually connect right to the brain. So you're using this as a pathway to get right to the brain in the center and work on all the cranial nerves. So usually this is going to help with the memory, the sleep issues, loss of sense of smell and taste, dizziness, and more. And for this, we'll use 121 hertz in our home use devices. Or we'll program 200 hertz with 3-to-1 modulation in the Pinnacle or Pro Sport 3. This tends to make the biggest difference when it comes to long haulers, but don't discount the value of the other protocols as well. Now, I mentioned the scalar chi as well here. When it comes to the scalar chi, it's all about repairing damaged tissue and organs and sort of enabling them to restore themselves to normal function through the use of 0-point fields. Scalar energy is so fundamentally useful across the board because it really doesn't matter which frequency or where you're treating. The body's cells find themselves restoring their normal function. They realign back into the right places. And this has made it one of the simplest treatments available. You can set your device to 7 to 12 hertz. You can increase the power to maximum or until you can feel it and point it where you want to treat. So I've got a scalar here. If it was plugged in, I could just point it where I want to treat here. Using this on problem areas like the lung areas, using it on the long bones, the epiphysis of the long bones for the immune protocol, and even using it on the brain can be key to undoing the damage of post or long COVID. Doing it for 3 to 5 minutes seems to be enough to make a difference each day. I see a question there as well, and I thank you for asking that. I did forget to mention it. When it comes to the tongue stimulation, I do like to do 10 to 20 minutes. If the person is dealing with a particular symptom you're trying to reprogram, like loss of smell or loss of taste, have them smell something while they're doing treatment, some sort of essential oils that's strong, that it's a pleasant smell for them. Try and engage those centers of the brain. It's the same with dizziness. I like to get people to try and walk as long as it's safe while doing it, so that they're engaging those parts of their brain, and then the electricity is sort of snapping into the right place. So good question there, but 10 to 20, 20 is the optimum, 10 is the minimum. Both are good options. Now, aside from the scalar thing being pretty easy to use, all of these things here, we've got quite a lot going on. And yes, daily is kind of what you'd be looking at with the tongue stimulation there. So I do want to remind everyone that there is a lot here. Obviously, this 10-minute training is a 15 to 20-minute training. There's a lot of different protocols to do. Most of the time when we're dealing with these longer, big protocols, we want to remember that we don't have to do all of them in one day. We can do 1 to 2 steps, and then for the rest of the day, we can take a rest. We don't have to do it all at once. Less is more when it comes to microcurrent. It's not going to get you better results to overtreat. It's probably going to make you worse. So keep it easy, keep it calm. It's very, very, very simple. Just pick 1 or 2, work through them in the order I've listed them. The basic things, the immune, the vagus nerve, even the respiratory if you need to, those should be done daily if you can manage it, because you're trying to keep up with these things. But we don't really want to send so many messages to the body that we absolutely blow it away and overwhelm it, and it doesn't know how to handle things anymore. So that is it for today. I have one more question here. What is the immune protocol on the evolution? It's pretty much the same as it is with the Pinnacle or the Pro Sport. You're following the long bones in the order that's listed in the immune protocol. It's too long of a protocol for me to do here, but there's the videos of it on YouTube. There's videos of it here on the channel, on the Facebook page. You can check those out. But you're essentially dosing each of the long bones in a certain order. And this is just because this is where the white blood cells can be released. We can essentially assign new troops in these areas and send them forth to do battle in our bodies. Now, that is it for today. If you have any questions, please add them in the comments below. I'll be sure to answer them. So thank you so much for joining me. If you found this video helpful, please comment on the video. Many of you already have. That's great. And just drop it a like or whatever it is, a thumbs up on there. The more likes it gets, it actually rises it up the page. So when people log into the support group, they see us, see this video, and they get helped with that as well. It just makes it easier for them to find. So thank you again. I'll see you next week for another Monday 10-minute training. And maybe, just maybe, I will actually make it in 10 minutes next week. No promises, though. Take care, everyone. Bye.